Hi, I'm Dr. Omid Hamid. I'm the Director of Translational Research and Immuno-Oncology at the Angeles Clinic and Research Institute in Los Angeles, California. Today I'll be discussing my oral presentation of Epacadostat plus Pembrolizumab in squamous cell carcinoma of the head and neck. This is ECHO-202 and KEYNOTE-037 study, a phase 1 and 2 study of the combination of Epacadostat plus Pembrolizumab. Patients with metastatic or recurrent squamous cell carcinoma of the head and neck have a poor prognosis. Conventional second-line therapy is associated with only a 3 to 6% response rate and an overall survival of approximately 5 to 6 months. The introduction of immune checkpoint inhibitors has provided new therapeutic options. Single-agent pembrolizumab in the second-line setting post-platinum failure has shown response rates of 16 to 18% per KEYNOTE-55 and KEYNOTE-12. These data are encouraging, and combination therapy was then initiated. IDO inhibitors like Epacadostat have come through knowing that tumors can evade immunosurveillance through a number of mechanisms, including immune checkpoint blockade and upregulation of the IDO1 enzyme. This is an interferon gamma-induced intercellular enzyme that catalyzes the first and rate-limiting step of tryptophan degradation in the kynurenine pathway. This leads to immune suppression in the tumor microenvironment. So it's postulated that treatment strategies that combine Epacadostat with checkpoint inhibitors can improve patient outcome. KEYNOTE-202 was a phase 1b, phase 2 study looking at dose escalation of Epacadostat plus Pembrolizumab. Initially pembrolizumab 2 milligrams per kilogram, and then in the expansions a set 200 milligram every 3-week dose with a phase 2 open label cohort expansion which included squamous cell carcinoma of the head and neck. The objective here is to report the safety and tolerability. Patients were greater than 18 years of age. They had confirmed metastatic or recurrent squamous cell carcinoma of the head and neck, excluding nasopharyngeal and salivary gland, and they would have had to have at least one prior systemic chemotherapy regimen, including platinum-based therapy. The demographics are shown here, with most patients having more than one line of therapy. HPV status is here with 34% HPV associated and 63 non-HPV associated. PD-L1 expression was based on tumor and immune cell PD-L1 expression, with positivity being greater than 1%. Here you can see the objective response rate by RECIST 1.1 of all-comer patients, with a response rate of 38 patients of 34% and a disease control rate of 61%. When you look at number of lines of therapy, a greater response rate in 1 to 2 lines of therapy as compared to greater than or equal to 3 lines of therapy, although the numbers are small here, and a better disease control. PD-L1 expression shows no clear bias and an equal disease control rate with these numbers of patients. And as previously reported, a higher associated response rate with HPV-associated squamous cell carcinoma of the head and neck, but a disease control rate that was similar. You can see in these waterfall and spider plots that disease response was rapid, deep, and durable in all types of patients, including those with 1 to 2 or greater than 3 lines of therapy, including those with low and high PDL expression, and also including HPV-associated and non-associated disease. Treatment-related adverse events is important here. As you can see, treatment-related adverse events were low, grade 3 and 4, 18%, mainly fatigue, diarrhea, and amylase increase. Dose interruptions in 18% of patients, the most common fatigue and dizziness. 1 patient had a dose reduction due to treatment-related adverse event. 1 discontinued treatment to an asymptomatic grade 3 amylase increase and lipase increase, which were manageable. There was 1 treatment-related death due to respiratory failure. Pneumonitis could not be ruled out. AEs of special interest were hypothyroidism, adrenal insufficiency, and pneumonitis, with no grade 3 or 4 adverse event of special interest. In conclusion, these phase 1/2 study results show that epacadostat plus pembrolizumab is active in patients with metastatic or recurrent squamous cell carcinoma of the head and neck. The overall response rate was 39% in patients with 1 to 2 prior lines of therapy, and disease control 65%. Responses were seen regardless of PD-L1 expression, HPV status, and number of lines of therapy. Out of the 13 responses, 10 were ongoing with a median range of duration of 18.4 weeks and up to 90.3 weeks. This combination was well tolerated. The safety profile was consistent with previously reported phase 1 findings, as well as the phase 1 and 2 safety data in other tumor types and the pooled phase 2 safety data from this study, which has been presented at this ASCO. In general, the AEs of special interest with this combination were similar to pembrolizumab monotherapy. The frequency of grade 3-4 rash was higher with this combination. The efficacy of this combination in squamous cell carcinoma head and neck patients was consistent with findings in patients with other tumor types, supporting an upcoming phase 3 investigation of this combination in squamous cell carcinoma of the head and neck. As you can see, this data is significantly hypothesis generating and does support a randomized phase 3 study that will be accruing. Thank you for your attention and time.